Hello everyone, I'm Missy Carl. I'm the VP of Clinical Services for Respiratory Partners. And Respiratory Partners is the respiratory component of CarDon and Associates. We are in every one of their communities, and our largest role is to assist with their pulmonary services. What we do is we get an inquiry for one of our communities, higher acuity. The liaison contacts us, and we'll make an on-site hospital visit, meet with the RT and the nursing staff to see what they're doing or what services they're receiving so that we make sure we continue that continuity of care. So we go back and we talk to the nurses, the DON, the team at that community, and then we make a joint effort decision on whether or not we can meet the needs of that specific patient. Once we do accept that patient, then Respiratory Partners will follow them. Respiratory therapists will see them on setup, on admission, and do any type of education training that we need to additionally for the nursing staff for that specific patient. We also will follow them weekly, if not more often, depending on what their acuity level is and how many services they need from the respiratory therapist. We accept a variety of pulmonary patients throughout the system. We offer a full line of respiratory services, everything from high liter flow residents all the way to people on room air that just need lung expansion therapy. So to start off with lung expansion therapy, we are very involved with the incentive spirometers. We're very involved with the EasyPap. In fact, we offer the RTs will do on-site EasyPap treatments if needed. If the residents are not getting their volumes that they need with the incentive spirometer, we work with the nurse practitioners, physicians, and we may get them to order EasyPap for a short-term time frame until we can get their volumes up. So the RT would go in and administer those as ordered by the physician, and then once they're meeting their goals, then we'll switch them back over to the incentive spirometer. We also are very aggressive with acapella, TheraPep. We also offer a full line of non-invasive vent management, and I did say the keywords non-invasive. So the big buzzword definitely is Trilogy, and we do BiPAP, AVAPs non-invasively in all of our communities. The key is we do make an on-site hospital visit, and we'll make sure we get the orders exactly, their tidal volumes, all of their settings for all of their volumes, pressures. Once we have that, then we'll get the Trilogy in. The RTs will go in and set everything up. Then the RTs will follow them weekly, if not twice a week. And then we also monitor once they admit. The key thing when we look at the hospital is what their CO2, serum CO2 or their CO2 is in the hospital setting. And then what we do in our setting is we'll get a serum CO2 weekly to stay on top of and monitor that and work with the physicians to make sure we keep their CO2s where they need to be for that specific patient. OSA management, we do a lot of that. That seems to be the specialty for sure. BiPAPs, CPAPs, auto SV is a key word, a key thing that we do. Auto BiPAP, auto CPAP. We're also very aggressive with our nighttime oximetry sleep studies. If we're questioning if somebody's desaturating or if we're questioning if they're having some obstructive, that's one of the first things that we'll do. And then we'll do that nighttime oximetry sleep study. We'll download that information the next day and get it to the physician. And then changes can be made, whether it's add O2 or whether it's eventually get them out for a sleep study, whatever we need to do. Airway clearance, love our airway clearance, especially our people with bronchiectasis, end-stage COPD. We offer the vest therapy. The RTs go in, we set everything up, and then we train the nursing staff, and the nursing staff will give the vest treatments routinely, and then the RTs will follow them in the facility. Cough assist, we do offer the cough assist. We also do quad cough. If we've got a specific resident who's in need of a quad cough, the nursing staff has been trained and able to do that. Airway management is probably one of our favorites for sure. We take all different trachs. And again, this is one that the RTs will see at the hospital setting just to make sure we understand what kind of trach they have, when it was changed last. Typically, all of our trachs have to be changed within 30 days. So we'll find out when the last trach change was. If it hasn't had that first trach change, then typically we work with the hospital, the discharge center, to have them complete or do that first trach change. If there's no complications, then we'll do them in the facility thereafter. But just so you know, in our setting, we're very active in downsizing. We work one-on-one with the nurse practitioners and physicians to make sure that when they come to us, what their goals are, where we need to get them, and then we'll move them forward, rehab where they need to be. Airway downsizing, speaking valves, we work with speech specifically with the PMVs, capping trials. When they get to that point, we'll work with the nursing staff, the physicians to get them started up with capping trials. And then we have had a lot of success in on-site decannulations. And then the RTs will do the routine trach changes. So once they've had that initial trach change and they come to us, then we as the RTs will change those trachs monthly in our skilled care setting. Another thing that we've added that we're really excited about is the Airvo heated high flow system. Routinely, our trachs that are coming to us are admitted initially, and we're putting them on the heated high flow system just so that we're able to get those flows, and then we're also able to start them off on 37 degrees, 34 degrees, whatever they need, and then slowly wean that heat down. But it's allowing us to take those trach residents sooner specifically, and also our COPDers that are needing higher flows and are maybe on the heated high flow system with the nasal cannula, we're able to do that in our setting as well. So we really think by adding the services that we have and having the RTs available 24/7, it's allowing us to take these pulmonary patients much sooner and allowing us to take them and continue the rehab to get them to meet their goals sooner, whether that's home, long-term care, whatever their goals are. So what's nice is that I think that, CarDon does an excellent job is that they bring the experts in to really help get their residents where they need to be. And partnering with us really allows them to meet the needs of these pulmonary patients. So we're really looking forward to seeing you at the Symphony on the Prairie, and we're super excited. And we're looking forward to receiving all your pulmonary patients. See you soon. Thanks.